Hey future doctors, welcome to Dentistionary. Here, you will be provided information from the doctors for the doctors. Today, we are going to study about anatomical landmarks found from the dental anatomy. These are of two types, elevated and depressed. So, let's begin with the elevated landmarks. These are of different types. First of all, we will learn about lobes. These are the primary section of formation in crown development. So basically we can say that when the enamel forms, there are some irregularities, and from that there are some round protuberances which are called lobes. These are of three types. First, mammillons. These are three round protuberances found on incisal ridge or incisal edge of newly erupted incisors which wear off along the time period, and they are found either in primary dentition or the permanent dentition, but only in the newly erupted incisors. Second one is cingulum. This is lingual lobe of anteriors. It makes up the bulk of cervical third in anteriors, as you can see in the image. Now the cusp. These are mounded elevation on the crown, making up a divisional part of occlusal surface. You can imagine a pile of sand on the ground. These are based on the location, the lingual or palatal, the buccal, the mesodistobuccal or the mesio or distolingual cusp, and the cusp on the canine tip. As you can see in the image, the different types of cusps. Now the tubercle. It is different from the lobe. It is not a primary section. It is the extra deposition of enamel. It is a smaller elevation, mainly found on the anteriors. Now the ridge. It is a linear or a line elevation on a tooth surface and classified on the basis of location and shapes. On the basis of location, these are marginal, labial, lingual, buccal, cervical, incisal or cuspal. The cervical and incisal ridge are strictly found on the anteriors and not on the posteriors. Let's take an example. As you can see in the given model, there are two types of ridges. The first one is mesial marginal ridge, the second one is the distal marginal ridge, and this is the incisal ridge. And for the next, this cervical ridge. You can see in the model there are some irregularities on the tooth surface in the cervical third portion. The elevations on it are called the cervical ridges. As you can see in the canine, there is a labial ridge, and in the posteriors there is buccal ridge on the premolars. And for the cuspal ridge, there are different types of ridge. The cuspal ridge descend from the cusp tip to the central part. These are the cuspal ridges. Okay. Now on the basis of shape, there are three types: triangular ridge, transverse ridge, and the oblique ridge. The triangular ridge descend from the cusp tips of the posterior tooth towards the central surface of the crown. These are named so because of the slopes of each side of ridge are inclined to resemble two sides of the tooth surface. As you can see in the given model, there are triangular ridges that descends from the cusp tip to the molars, to the central part of the premolar or molar, and the slopes that inclines from the ridge makes a shape like triangle, so these are called triangular ridges. As for the transverse ridge, transverse is the union of the two triangular ridges which crosses the tooth transversely. This is a transverse ridge. Now the oblique ridge. These crosses the occlusal surface obliquely. These are mainly found in the maxillary molars, and this is formed by the union of triangular ridges of distobuccal cusp and the distal cusp ridge of the mesolingual cusp. As you can see in the given model, this is a maxillary first molar. As you can see, the union of a triangular ridge, distobuccal ridge, and the distal cusp ridge. These two forms a line or a ridge which is known as oblique ridge. It crosses the occlusal surface obliquely. That's why it is called an oblique ridge. So that's all for today, guys. In the next part of the video, we will study about depressed landmarks. I hope you found this video useful, so please like and share the video and subscribe the channel. And if you have any queries and suggestions about the video, please comment down below. We will try to solve it as soon as possible. Thank you so much.